You're watching the Wellness Hour Live. I'm Randy Alvarez. Today's topic, new treatment options for women that need breast revision surgery. With us, we have a board-certified plastic surgeon, Dr. Tenley Lawton. Dr. Lawton, welcome to the program.
Thanks, Randy.
Now, we've had you on the program before,
Yes.
talking about some breast cancer topics and other things. So this new, I said, come on the program, talk about what's new.
Right.
So tell me about this. What is it? You said it's called Siri. Or
Sari.
Sari. Okay.
So Sari is a silk scaffolding. Many women won't have even heard of this before. They'll heard of products such as Alloderm or Stratus. And the difference between those category of products and Sari is you harvest Alloderm from a human, you harvest Stratus from a pig, and the silk scaffolding called Sari is actually made from silkworms.
Okay.
So people have heard of silk products before based on suture. And so one of the things that people will immediately think of is tissue reactions when it comes to silk. But there's a proprietary process involved with Sari where they remove one of the structures that makes it inflammatory. So the beauty of Sari is that it can be used in the same applications, not all, but many of the same applications as the acellular dermal matrices like Alloderm and Stratus. But it's a significantly reduced cost to the patient, the hospital. We're all worried about healthcare dollars.
I want to make sure that I'm following this. Okay, so for breast revision surgery,
Yes.
describe the situation where they would need this and where you would inject. Is it injecting?
It's not an injection, it's actually applying, sewing in a product. So it's a sheet.
So it's like scaffolding?
Yeah.
Scaffolding in a way?
It looks similar, it comes in a package similar to what Alloderm or Stratus would be, but it's a more pliable material. It actually looks like a piece of fabric.
So what type of breast problems would be ideal candidates for this? Describe it.
Ideally, it would be in a patient who's had, obviously, some form of breast surgery before. Let's say their implant has been malpositioned. If you hear about people who
Like
say
uneven breasts?
or like one's bottomed out, it's too low. It's gone below their inframammary fold, which is the bottom structure of the breast. If the implant has somehow gone below that structure, one of the options is just go in there and sew it up and then put the implant back in, and that usually doesn't work. The reason for them getting the bottoming out in the first place needs to be addressed. So if you put the suturing in there and then support that suture line with this tissue called Sari, then your body actually replaces the silk with its own collagen. So within 2 years' time, there's nothing left in there.
So it's like a holder in a way.
It's a support system, yeah.
Okay. So what's another application?
Another application
What other type
would be,
of what
let's
other
say
type
you
of breast problem I'm trying to say?
It's more like positioning and supporting the tissue. So somebody who already has naturally droopy breasts and has had some sort of, let's say, a reduction or a lift or something like that, gravity still continues to work on those patients. So if you really want to reposition the breast in a higher location, you can use this to support that as well. It's been used in other applications as well, but it's not FDA
So for
approved.
breast surgery, there's a certain amount of women that, because if they have larger volume breasts, they start to sag because of gravity. And
Can be.
Okay, and you're saying that you can go in with this.
Support the tissue. So not only are you doing the lift, you're still taking out skin, moving the nipple areolar complex, doing all those things, but then in order for it to not fall back down due to gravity, this will support the breast and keep it up where you've repositioned it.
Okay, and it's brand. How new is it?
Just in the last year, it's been FDA approved and released for surgeons to use. It's been being studied for several years, but just this year.
So you say malposition breast implants. This is ideal. And what's the downtime like? What are the costs associated with this?
It doesn't add downtime to what you're already doing. You usually would want to use a drain in most of these patients anyway, so you're not doing anything to further the recovery. And the benefit of it is you're going to have a better support system, so the likelihood of actually making the operation work is much higher. There is a cost associated with it, but most of the time when you're doing these revision procedures, you're using some sort of tissue matrix like Alloderm or Stratus, and those are much more expensive. So you cut the cost in probably less than half by using this type of material.
Well, Dr. Lawton, I want to thank you for coming on the show. And if
Randy.
people want to learn more about this, where do they go?
The company is Allergan. So on Allergan's website, they can look up Sari, which is S-E-R-I.
All right. Okay. Well, thank you. Always a pleasure to have you on the show.
Thanks, Randy.
You're watching the Wellness Hour Live. I'm Randy Alvarez. We'll be right back.